Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hi, welcome to the Medical Collective. We are back today. I'm excited to have Dr. Leslie, Dr. Sharon, Dr. Atoosa, and Dr. Dan again, and I'm Dr. Keisha Davis. Today we have a little bit of news before we get started, and that is something that I saw on NPR, and it's an article on blood pressure readings. The key point was that properly sized cuffs, location, how you're holding your arm is all important. And some people, you may be getting a wrong reading. And if you have a wrong reading, are you going to the hospital when you need to? Are you believing you have hypertension or don't have hypertension? So we're going to talk about it with Dr. Leslie Ann on her thoughts about blood pressure readings and these home cuffs, and then also talk about the wrist cuffs, because people do that too.
Right. The wrist cuffs. I never recommend the wrist cuffs. Don't use the wrist cuffs. The wrist cuffs are just not accurate, people. Thank you. Now, one of the things that I did in my practice all the time was to encourage patients to get their own blood pressure cuff at home, especially if they were hypertensive and we started them on medications. I wanted them to keep a log. And part of the responsibility of encouraging them to have that is to teach them how to do it right. So, number one, don't go take your blood pressure after you didn't had an argument, you're mad at somebody and you're upset. Your blood pressure is going to be elevated, Don't drink it. Don't take your blood pressure after you had a cup of coffee or, caffeine, all of these things that can elevate your blood pressure, if you have a headache, that kind of stuff. So sit down, feet flat to the ground. Don't cross your legs, not at your ankles, not at your knees. And I've had to correct many medical assistant when I went to my doctor, and I purposely crossed my legs to see if they would tell me to uncross it, and they didn't. I said, "Did you want me to uncross my legs?" Yes. So you cross your legs. Your arms should not be down. It should not be up. It should be at the level of your heart. So laying it on a table, it should suffice. And you want to put the cuff right around your arm, not your forearm, but your actual arm. On the actual cuff, it will give you directions on where to place everything. And it even shows you how to measure to make sure that you have the right size cuff. Because if the cuff is too large, you're going to have a falsely low blood pressure. If your cuff is too small, because, you're going to have a falsely elevated blood pressure. So, and the other thing is, don't talk. Breathe, close your eyes, relax while your pressure is being taken. And that's a quick and dirty.
Great points, Dr. Leslie. Great points. Thank you.
But the other thing too, Dr. Keisha, is that they do need to log your blood pressure. So when you come to your doctor's office, you have trends. So we can look at the trends. We can say, okay, we need to increase your medication, or we need to decrease your medication. Or we can look at the actual the data in the cuff. But it's often better to have that sheet of paper so we can kind of, what happened this day when you were 200 over 150? So.
I think that was important that you brought that up, Dr. Leslie, because in the emergency department, sometimes we see people what we call white coat syndrome. Just because you came to the doctor's office, you freaked out, you're anxious, and your blood pressure's up. Spurious blood pressures doesn't make us do anything. We kind of just assess it. And to Dr. Leslie's point, there should be a trend. So if on Monday you came to see us and your blood pressure was elevated, we found that as a finding that may not have been what you came in for, then we might refer you to the primary care doctor and say, okay, we'll go follow up with Dr. Leslie and let's see how it is next week. And you should have been taking your blood pressure during that time and up to that time. And she can then say, oh, this is real. This is actually consistent Maybe there's something we need to check out. Maybe something related to your kidneys or other medical problems. Does this run in the family? Are you having any symptoms, faintness, blurry vision, fatigue, tiredness, all the things that kind of go along with that? So many medical devices. You got your Apple Watch, you got all the different brands of technology that actually can measure these vital signs. Sometimes are spurious, but some are very accurate, but at least it's making people health conscious and aware. So we like that. Thank you.
Can I add this before we go on? Because Dr. Dan, you bring up a good point of the white coat hypertension. There's also mask hypertension. And this is why the trend is important, because you come to my office and your blood pressure is golden, but at home it's elevated. That will do you more damage. So it's important to know that we do have to treat the mask hypertension, because on a normal level, you're elevated. Thank you.
Great points, everyone. And also, if you look at the previous episode, I believe it was episode 3, Dr. Sharon was talking about preeclampsia. So you can listen to that episode to find out more about that. Okay, we have 2 big topics today, global health and the health of immigrants. Very important. And we are here not in the capacity of representing anyone or having any specific belief. We all are representing our individual selves. So as this election is here, we want to inform and just educate you on the facts. So one of the things we're going to talk about is what global health is, what it matters, and where you can be guided as far as the next election. First of all, WHO, World Health Organization. Why global health? Why do we care about other countries' health? Well, first of all, nobody stays here. And if you don't know Dr. Leslie and some of the others, they travel. We travel, goods come in and out, people come here, right? So it does matter. But really, global cooperation is vital for preventing spread of diseases. COVID-19, Ebola are a couple of cases, but the benefits from WHO's efforts are to detect and manage healthcare. We can see how other countries are doing it, getting right, what we need to do to improve here as well, and what we can do to help other countries improve. The economic impact of global health is that pandemics can cost an economy up to $570 billion globally. COVID alone cost about 3.5% of global economic contraction. And so this affected actually the United States markets. As far as national security, healthcare crisis abroad can destabilize a region. We see what's going on in Uganda, creating refugee crises and also undermining the foreign policy efforts. So if you're dealing with the healthcare crisis, your economy's not doing well, you're not able to focus on what you need to grow. And a couple of myths I want to throw at you all. A couple of myths. And of course, we're going to demystify those. The United States can maintain global health security without the WHO. That is not true. The WHO coordinates a response to pandemics. Just what happened, and I will mention quickly, and maybe you all can talk about it. Trump had actually withdrawn us, the United States, from WHO, and Biden, when he became president, did reinstate us. But it actually weakened during that time the ability to influence global health policy. Any comments on that one?
I'm Dr. Atoosa Kourosh, and I'm a pediatrician and immunologist, and I've worked overseas as a part of global health initiatives, going back more than 20 years, and even some during my training. And I know that, as Dr. Keisha mentioned, contagion knows no borders. So our economy is globally connected, but so is our travel. And as Ebola demonstrated and COVID demonstrated, there's no containing those contagious viruses in one country or even one region. So for us to not have our finger on the pulse of what's going on or be able to protect our own country because we have no say in how contagions are managed is one reason why participation in WHO is vital. But the other is because we are literally one human family. And to think that nothing will happen to us if another country collapses is also mythological. It will, the collapse of one economy will also lead to a global downturn, especially if it's a larger country or a country that impacts a specific trade. So for all of those reasons, it's very important for us to have not only a hand in the dialogue worldwide, but also in policymaking.
Great points, Dr. Atoosa. I have 2 more myths for you all that I want to hear your thoughts. The first one, the WHO is politically biased and ineffective. Well, We know that. While there may be some complexities that are political, the WHO's mandates and their decision-making is grounded in scientific evidence. Just like right here, we are scientific, we are based on research, and it coordinates critical global health responses that actually benefit the United States. The next myth is the United States overspends on global health initiatives. And I think that's why there was, some of the disinformation going around about why do we need to spend money on that or be part of it. The United States only contributes 22% of WHO's budget. But these funds help mitigate global health crises and would otherwise devastate the United States public health and economy. So those are two other things. Did anyone want to talk about those briefly?
Don't get me started on the United States spending, okay? And what we do with money and the things that we justify. And people being upset if we are contributing to global health. We are not an island. And this notion that the United States can function America only is just really void of any sense of common sense, truly. And we spend money doing more disastrous things. And as a part of the global family, a country of immigrants, it is appropriate that we spend money to ensure world health. That's good citizenship. That's good leadership. If America is to lead, then lead. And this is part of the leadership.
But I want to distinguish, if I may, between global military spending and global public health spending, because I think those two are being conflated in the discussion in social media. And I'm not saying that they are not interrelated and that there wouldn't be more resources available, but frankly, to say we shouldn't spend on global health because our own public health infrastructure in the United States is underfunded doesn't make sense, as Dr. Leslie just pointed out. I think what you can say, we should spend less on military spending and spend that money on public health. And I think that might be an argument that you could take on in a political situation where you're debating that policymaking. But frankly, we are not debating that policymaking at the moment. We're talking about whether the U.S. should be invested in global health at all. And I think that the answer should be an unequivocal yes. To what extent and how much money is spent where, that's a decision for high-level policy. But I think that we can weigh in and we can give our opinions. But I definitely think that right now we can't blame any underfunding of the U.S. infrastructure on participation in WHO or any other endeavors. And I think that's a myth that needs to be addressed.
Those are great points, Dr. Atoosa. And as far as WHO funding, the United States contributed over $893 million to the WHO in 2018-2019, and that just made up more than about 15% of its total funding. But when you talk about the importance of global health, the pandemic preparedness report by Johns Hopkins showed that countries that integrated into global health networks were better prepared for pandemics. We're better prepared. And this was a position that was unfortunately weakened during certain times. And I only want to say that, and again, we're just here to inform and to educate, because I'll let you know, if we're talking about global health and WHO, some facts that actually have happened. During Trump administration, there was a halting of the funding for WHO and withdrawal. We did not join COVAX during that time, which was the global COVID-19 vaccine distribution initiative. Also, the dissolving of the NSC, which was important, and the directorates for global health security at the same time. There was cutting proposed for global health funding and several budgets. And we just mentioned there's a portion of it. It's not the same as military budgeting. There was also proposed cutting of United States global health funding and several budget requests, and ending of the funding for UNFPA, which is an administration. On the contrary, and just to inform you, Biden-Harris administration, they reversed the decision to withdraw from WHO. So Biden did reinstate us into it, rescinded the expanded Mexico City policy. So they tried to reinstate things that were necessary again for global health. They joined COVAX, committing to the United States to be the largest global donor for COVID vaccines. They created also the Bureau of Global Health Security and Diplomacy. They supported WHO's negotiations for a new pandemic agreement, and they also revised the international health regulations. So those are things just to take into account when we're talking about global health. The information is here for everyone. I will put some resources in the notes so that you can read it, but please be aware that being part of it. The next time you go on a vacation, think about that. If another country has to be shut down that you can't go enjoy, think about the importance of being part of a global health community. All right, so here's another thing that we need to talk about, and this hits home because if you look at the doctors on this stage, more than 75% of them are immigrants. More than 75% of them are immigrants. And we need to talk about the health of undocumented and documented immigrants. I will put a resource so you can understand about natural citizens and all of that and what it means. And I think we also need to be careful with the words we use so that we're not using derogatory terms to represent a group. Immigrants contribute $1.3 trillion annually to the U.S. economy. I didn't say million or billion, I said trillion. They ensure, this basically ensures healthcare access. It's vital that we make sure that their health is maintained and that they have a healthy workforce. Listen, if you're sick, you can't come to work. We dealt with the pandemic, right? We were waiting for the drivers to come bring our food, but yet some of them had COVID as well, and we were expecting them to come, or we're expecting the food to be stocked, but the stockers were sick. So if your health workforce that you depend on for white collar and blue collar jobs is not taken care of, then you won't get what you need. There's barriers to access for immigrants. Undocumented immigrants, unfortunately, face more significant barriers. 45% are uninsured in 2020 compared to 9% of the U.S. citizens. So I have a couple myths for you guys, and I'm loving to hear what you have to say. First myth, undocumented immigrants receive free healthcare and drain sources. Not true. Undocumented immigrants are excluded from federal programs like Medicare and Medicaid, and guess what? 45% of undocumented immigrants are uninsured, and most of them pay out of pockets. Any thoughts about that myth?
I mean, yeah, these are the patients that come to the emergency department, it's unfortunate. We believe, or at least I believe, that healthcare is definitely a right, and people need to have access to that, no matter creed, color, race, where you're from, immigrant, no immigrant. The immigration policy is what they need to fix, and that needs to be addressed, where everybody feels like immigrants are paying their own share, but it's not that they're not. They're doing it in different ways, and I think there's a better way to do it, and that's a policy thing. Don't conflate that with the healthcare thing. I think we're human at the core, and we need to take care of our fellow brother or sister, and access to care. Your family member, your relative, or just a fellow human being like yourself needs healthcare. And that's my thought on it.
So, being an immigrant, it means a lot to me. It means a lot to me because immigrants sacrifice just about everything to be in this country. They sacrifice their livelihoods in their home nations. They sacrifice their children. They leave their children to be in this nation. Some bring their children. But there was a phenomenon in the Caribbean at one point in time that I termed the barrel children. And that was my master's thesis, and talking about promises of America being sent in barrels of goodies to the islands. And there's just so much trauma in the whole process of emigrating to the United States than to come here and be treated or talked about in such an inhumane, disgraceful manner. It is beneath leadership, it's beneath the United States as a global leader. And to state that they are taking from us, that is the same arguments that Hitler used in Germany. Those are arguments that dictators use to scare people into insulating and feeling like everybody else is taken from them. So they're the bad guys, let's attack them. That's not true at all. Immigrants are paying cash, as Dr. Dan have said, or they're not coming to the doctor. They're not seeking care. And so, I dare anyone who believe that immigrants are eating away at American healthcare to show me the facts. Yes, there's a problem with immigration. It's not sustainable as it is. It's just not sustainable. But we can address that issue with honor and respect and humanity. These are people. And were not for the grace of God, it could have been either one of us. I came as a student, and, I have been offered privileges. That's not everyone. So
I love that, Dr. Leslie, because I think we sometimes, especially as Americans, take a lot of things for granted because we haven't been without those. The myth about immigrants burdening the healthcare system by increasing costs. Well, guess what? They contribute more in taxes than they receive in benefits. Preventative healthcare for immigrants actually reduces emergency costs. So that's one thing. In addition to that, there is a little bit of a statistic. And immigrants contribute $11.7 billion annually to state and local taxes. And that's according to the Institute on Taxation and Economic Policy. So they are contributing. Another myth, immigrant healthcare is a priority. I think this is the thing, too, that the problem is that we think someone's getting more than another. They actually face barriers to accessing healthcare, and their care benefits for the entire healthcare system are helping at the same time, helping reduce spread of diseases, lowering ER costs, like I mentioned. So it's not true that they are a priority. It's not true that they're a burden. They are a contributor, an extreme contributor to this society. And I think we need to think about that in the words we use, and also as leaders and how we set the tone for that. It's very, very sad.
I think you've said it. If some people are the least, and I would say, we have this image of immigrants being the ones who are crossing the Mexico-U.S. border. We have immigrants who are coming in other channels. We have immigrants who, and if we say illegal immigrants, who are coming in with finances, lots of money, and working themselves in the system. I can name some names of some top people who were in the United States without the proper documentation, right? And they're a different color, because what we're doing is we are vilifying brown and black people. Anyone who is not Caucasian is seen as the enemy. But when we look at immigration, how many people who are not not black or brown overstayed their visas? All right? Okay.
Very, very true. And I'll say a couple of things about both administrations, again, just to inform, because we're talking about immigration health. So during the Trump administration, he expanded the public charge rule, which was considering the use of Medicaid in public charge determinations. This basically made it harder for immigrants to access public services. He issued a proclamation that suspended immigrant entry unless they could prove health insurance. He rescinded DACA through the Supreme Court that ruled against the recession. And then we go to the Biden-Harris administration. They rescinded DACA through the Supreme Court. They ruled against they rescinded Trump's charge or regulations. So they restored guidance excluding Medicaid for the public charge. They revoked Trump's proclamation requiring proof of health insurance for immigrants, which is crazy to get in here. Remember when we had to have a COVID card, right? But to say proof of health insurance, many of us don't have proof of health insurance. He extended marketplace eligibility to DACA recipients, allowing an estimated 100,000 DACA recipients to gain healthcare coverage. So this is all under the Biden-Harris administration. And again, we're talking about immigration healthcare, we're talking about the healthcare of all of us. We know that the healthcare of those that are of certain minority groups have less access, have poor care. That was actually another thing. There was a survey, and many said that they felt that they did not have good health care, that they were treated poorly when they went to the healthcare as immigrants. And that shouldn't be the case, because what happens is you are less likely to go to the doctor. Then you end up with the burden. If we're concerned about money, let's deal with the burden then. The burden comes back on the economy. You don't have the workers that you need in this beautiful melting pot of the United States that we should be. So anything else that you all want to add on immigration? Because how has it treated you, and how does it feel when a president is setting a tone or not setting a tone, or a leader as far as immigrants, especially because you're in healthcare. You're a vital part of the society. I don't think we could do medicine without you, or do this podcast without brilliant minds. So what are your thoughts?
That's a really great point, Dr. Keisha, is that there is actually, a lot of people that come to this country bring their brain power, their resourcefulness, their industriousness, and they become a vital part of it. And there's a large proportion of undocumented, the Dreamers, the Dreamers Act that President Obama brought into being, and which was rescinded by the Trump administration and then reinstated by Biden. That these children that were born here, their parents were undocumented, and then they had difficulty getting documentation, or they were brought by their parents as infants, and so they have no choice in coming here. A lot of those people served in the military, were valedictorians of their classes in high school, were bound for college careers, they're already contributing members of our society, even so young, even in their teens and early 20s. And I know that when I came here at 7 years old as a refugee, escaping the Islamic government of Iran, which was trying to assassinate my father and kill my family, and succeeded in killing my uncle and several other members of my family, I was literally running for my life as a refugee child. And that the country that accepted me in the 1980s, that country, that's the country I fell in love with, which became the homeland of my heart. And that's how I feel about the United States. That's the homeland of my heart. So having the previous administration spewed the rhetoric of rescinding citizenship of people who were naturalized, of deportation under, spurious conditions for whoever they decided to deport. That was frankly extremely scary to me, because I'd already lost one homeland to a bigoted government that was trying to kill me and cared nothing for my humanity as a child. And it felt like that was repeating again in 2017 when that rhetoric began. So it is. Does it feel like an existential threat to me and my family? Yes, it does. Even though I am a naturalized citizen, I've been an American citizen for decades, and I am a physician, and I've contributed not just economically, but to the health of this country. So I do take it personally, yes, and it does hit home, and it does strike a nerve for me as a refugee child who became a proud American. One of the other things I was going to say is that the idea that no one should come to this country would make the United States poorer in its culture, in its intellectual assets, in its economical capacity, economic growth capacity. And I think that's what people should understand. This is somewhere where my family had religious freedom and the capacity to get educated, which I would not have had if I'd stayed in Iran. So I think that's one of the amazing things of this country since its inception, which is carved into the base of the Statue of Liberty, is that we welcome those from afar because we know it enriches our nation. So I think that is the attitude that this country always had, and this new anti-immigrant attitude, it's very un-American. So that's the other thing I was going to point out.
Dr. Atoosa, not only is it un-American, what they're proposing is impractical. It's impossible. Unless they are able to round people up like the Germans did in Nazi Germany, it's impossible to do that here. We're not standing for that. But the other thing is, it's a rhetoric that feeds into fear. When people are afraid of the other, rather than getting to know the other and embrace the other, when they are fearful, you play on that fear. And anyone who plays on the fear of the vulnerable is evil. Simple. I said it. Yes, podcast, you heard me. Because it tears, because there's no gain in it for the people whose fear you're stirring up. You know? You're setting them up for even more disappointment, which now invokes more rage. And now you have this ball rolling down the hill, a snowball rolling down the hill. So I find it's empty rhetoric that can have dangerous repercussions.
Well said, Dr. Leslie. Dr. Dan?
I mean, the story from Dr. Atoosa and Dr. Leslie definitely hits home for me. My parents, of course, immigrated here also, and I'm first generation American, but when we look at it, at the melting pot that America is, even in our service, I served as an infantry officer and battalion sergeant, so I got to see all our Joes. We were on the front line getting shot at and dealing with all of that. But you look into the left or the right, we don't see race. We never looked at it that way. We're just brothers and sisters and what we call a foxhole. But in the case, we're all in it together. And to serve your country and then to have those types of things said about immigrants who naturalize or who are in the process of naturalizing or who are there here illegally and trying to just have a better life and future for themselves, for their families. I mean, I look at it, I'm not perfect. I was fortunate and blessed to have the opportunity to be born here. There are many, it's not that I deserved any accolades, I was just fortunate. And there are others who are better, who I would say better than me, who didn't have the opportunity. So why would I squander this opportunity? Why would the country that gave me that opportunity then turn around and yank the carpet under my foot? So, and after serving for the country, oh yeah, it's definitely not going to go down that way because you felt like you sacrificed and you given your all. So I don't think America, the true America, will stand for it. And but it is something that impacts us, not just healthcare, but every other facet of our lives.
Well said. And as we sit here and those of us fellow Americans who were born as Americans go to bed and not in the midst of a storm, and let's take the I am off immigrants and say migrants. And imagine if you are in the midst of the Florida storm and you wake up and you no longer have a home and you have to go somewhere else. Think about how you would feel if you are displaced, even if it's to a different state or Texas. Texas is a place upon its own. And now you have to restart everything. And if people were to say, oh, you're that Floridian, and it had a negative connotation to it. So think about that, and words matter. So my heart goes out to all of you, and you are all greatly appreciated.
Oh, we do talk about y'all Texans, though.
That's okay. And speaking of a fellow Texan, we have Dr. Sharon.
So I just think on a whole that immigrants have been vilified by this or the former president's rhetoric, and it's basically been spread throughout his campaign. And what that does is that it gives people a sense of, I guess, kind of entitlement over immigrants, and to think that we are nothing when a lot of us have come here and contribute to the economy, the society, do great things, great work. So I just think that is a false narrative, to think that immigrants are just a a bunch of people who are not contributing anything here and are living off the system. No, we work, we pay taxes just like everyone else and contribute to the society like everyone else. And it's whether you're an immigrant who's might be a green card holder or an immigrant who became a naturalized citizen, just like me.
I know that this nation has sometimes fallen short of its promise and its destiny, and even the conception of the founding fathers, most of which, by the way, were immigrants. But I still have a lot of hope for this nation's future. And I know I say this a lot. Things are dire, but I have hope. And I really mean it, because I feel like this country, maybe more than any other in the world, has the capacity to become a leader in this vein of knowing how to value all of its assets, its intellectual and cultural assets, its human assets. And some people tout certain European countries and say, they have all these natural socialized medicine, they have great educational systems, but they struggle with the same immigration duality of opinion and the same kind of struggle of public opinion for immigration as we do. I know Canada has sometimes done a better job of accepting immigrants and valuing them and making them so welcome that they're able to rapidly become very productive Canadian citizens. And one of my friends, her parents, rather than coming to the United States, she grew up in a similar way than I did, fled from Iran with her family to Canada about 40 years ago. And she said that the Canadian government actually approached their faith community, the Baha'i community, and said that they've actually identified certain immigrant communities that become very active and very economically sound in a short matter of time. And they did sort of case studies and figured out how to get other immigrant populations that were struggling to the same economic productivity, plugging them into educational programs immediately, getting them into ESL, or if you're in Quebec, learning French, and try to learn how to help their immigrant populations become immediately self-sufficient and useful. And I thought that was so brilliant. And I think that there's a lot of possibility if the U.S. embraces itself as a nation of immigrants, which it has always been. There is the possibility to say, how quickly can we get immigrants from landing and struggling to immediately productive? Now, it's very different when Leslie Ann comes for education because she's already plugged into an educational system, right? Or when my family came, even though we were refugees, my dad immediately got into a PhD program. And so we had health insurance through his PhD program. And we had, we lived on his student stipend. So we were by no means, wealthy, but we got to the point where we were plugged in educationally. So there are ways to figure out how to get even the most dire situation populations that come from war-torn areas of the world and hurricane-ravaged areas of the Americas or other places, and natural disaster-ravaged areas. There's even ways to get those populations into a groove where they function with self-sufficiency and with maximum economic output in a short amount of time. And I think it's a matter of will, like deciding what we want. Do we want to build higher walls, or do we want to understand the gems that are falling onto our shores and coming onto our shores, and those gems of human beings, turn them into the most successful Americans?
Dr. Atoosa, thank you for, I'm sitting here and I'm thinking, and we sell this American dream, right? It's sold heavy. There's a lot of selling of the American dream, and then people come and realize it's something a little different. And I think back of people who have migrated here, the Italians, who weren't so accepted. Yeah. So I want to push back on this idea that America has been opened to immigrants, when the history really doesn't say so altogether. And there's been forced migration. So you have slaves being ripped apart and brought here and not integrated, but used to build a society that they cannot be a part of. So I have some thinking to do about that, because I think it's a history and it's what's been sold, but I don't know if what was sold is what we should have really bought, right? The American dream. I mean, Dr. Atoosa, I grew up in Trinidad, and we had Iranians come into Trinidad for the same reason that you came to the United States. One of my great friends, Sharzad, she's Baha'i, and she went to my high school, and that's how I learned about the Baha'i faith. But that's what we do in a small country. So I don't know. I think there are smaller examples of what embracing people with different cultures and out there. And I would venture and say that Trinidad has done a job of bringing the Chinese, the Lebanese, the Indian, the African. We came on different boats, different circumstances, but we're there now, and we are integrated into each other's lives. And I think that's something that America has done, but there's so much pushback for lack of understanding.
Well, I agree with you that island nations do a great job of that kind of integration. I've seen that in other places too, and have certainly heard about it with Trinidad. And I want to just clarify that I didn't say that the U.S. had lived up to its destiny, but that it espoused a destiny that, if it chose to live up to that ideal, could unlock the most successful America, the most thriving America that we have ever seen. And I think that's what I was trying to say. I absolutely agree with you that people have, that Africans were brought against their will and enslaved, that Native American populations were enslaved and massacred. I absolutely agree. Those who were already here suffered at the hands of the first immigrants to come to America. But I think that I'm not discounting that at all. I'm simply saying that what our country has yet to live up to what is in our constitutional ideals and in the American dream, as you so eloquently put, but that destiny is still possible, but it's a matter of collective will to achieve that destiny.
Yeah, that and integration. I love that you said that, Dr. Leslie, and everyone, thanks for your shares. You're seeing doctors, not just on the clinical side, but truly sharing their story. And I think it's important because as immigrants, as this nation, we all need to be welcoming. And those of us that have been here sometimes did not even feel that welcoming. So it's not just accepting people for their work and care and what they do, as Dr. Dan has done for this country, but it's truly embracing them, and do you respect them outside of it? And I close with this because we remember when we talk about Dr. Charles Drew and heard the story, and you will hear that during Black History Month, that he had an amazing discovery of preserving blood. However, he was not able to donate his own blood. It was not accepted during a war when it was needed. So are we accepting other people entirely for everything that they are and what they have? And that's important, because when we talk about healthcare, it's important that we accept them because it deals with how we're treated, how people, the outcomes of the whole world, and if those worried about money, the economy. So we talked about global health today. The good things and the facts are that we had re-engagement in global health under Biden. And then also, as far as immigrants' health, policies under Biden have expanded healthcare access and reversing many of the things that were done under the other administration. So it's important that we advance. It's also important that we think about our mindset and the words we use and how we treat people, and including our frontline workers and our doctors. So thank you all for being here. Until next time, it's still Breast Cancer Awareness Month, so the next episode will be on breast cancer. Thank you, everyone. Thank you for tuning in to The Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.